I'm Shane Austin. I play quarterback for University of Hawaii, and I got introduced to the Acuscope, Myopulse, a couple of years ago by my dad, who knows John Thorp. And, you know, I've had some knee injuries over the past just for wear and tear from the football seasons, and I came into John to get treated, and really just only in a couple treatments, I was ready to go and play through the season. This past season, I got in a car accident a week before a game, and my back was aching. It was no serious injuries, but my back was definitely, I don't know if I could have played, you know, without using this machine, because I got just a couple treatments and I was able to play that Saturday. I don't know if I could have been able to be on that field without this equipment. Just this last summer, I was wakeboarding and got in an accident and messed up my eardrum and my head, and just attached some ear clips and a headband, and I was good to go the rest of the week. You want to get treated by John Thorp himself, or somebody that's certified under John Thorp, because that's when you know that you actually are getting the right service and it's not just some amateur, but you want a professional treatment because it really does work.
Dr. Don Snow. I'm a doctor of acupuncture and oriental medicine. I'm here today to discuss John Thorp's electroacuscope and electromyopulse. And what I quickly discovered was I got about 80, maybe even 90% efficacy with the electroacuscope and electromyopulse. And it actually worked on those patients that had failed with acupuncture. Immediately, the patient will tell you that their feeling is back, and after 3 or 4 treatments, often the patients are 90%, 100% efficacy in getting their feeling back, and they're finished with the treatment. They only have to come in once every 3 or 4 months for a had a quadriplegic come in here from Utah. He couldn't feel from his shoulder down. He now has feeling down past his elbow, and he can wiggle his thumbs, which doesn't sound like such a big deal, but if you're a quadriplegic, it's a big deal. And that was only after 3 treatments. I even have a leukemia patient. Didn't know she had leukemia when she came in for back pain. I plated up her kidney area. After about 3 treatments, she went to go get a blood test, and her white blood count went down. I have a record of that. About a month later, she went and had another one. It kept going down, and it's still dropping today. She feels fine. She has no more backache, and her kidneys are fine. We had a multiple sclerosis fella come in with real bad spasms, confined to a wheelchair, couldn't move his right arm, could move his left limitedly, and after 1 treatment on a bilateral spinal with the machine, he called and told us that he was able to use the computer and raise his hand above his head, and he was in tears. Had a little boy in Germany. He had lost his finger, and they reattached it in Germany. After about a week and a half, the finger was indeed falling off. The MD said in 3 weeks it would be gone, and he was just not going to have his finger. It was about from the 2nd digit up. Baby today now has a finger you can't tell it was ever severed or anything, and that sort of was the most miraculous thing I've seen with the electroacuscope. It was marvelous, and I usually reserve the machine, the electroacuscope, for those patients that don't respond to acupuncture well. It's amazing how fast patients get better. I've never been acquainted with a company that has been more supportive. John has gone above and beyond the call of duty when it comes to support, and just the best support that I've ever seen in any company here in the United States.
For basically all of this century, the accent has been on the chemical and not on the electrical. And then, about 20 years ago, a doctor named Robert O. Becker, using basic science research, proved that the body has the same type of solid-state electromagnetism that's the foundation of modern technology. You maybe have heard the term semiconductor. The semiconductor industry is what makes computer chips. And Becker discovered that the body is based on semiconduction also. So there are microelectric currents flowing through the body. In the brain, it's a major part of brain function, and it controls physiology throughout the body. For years, doctors have not known what causes brain waves. Well, they think, well, maybe it's the firing of the nerves, but they know it's not the firing of the nerves. So it turns out that it's also these semiconducting electrical currents that are happening in the perineural cells. But it turns out that these cells are also electrically active, that they're high-tech semiconducting currents. And so these are controlling the neurons and play a really primary role, not just in the central nervous system, but in the peripheral nervous system. And so these are the currents that get blocked up in pain and injury and sometimes in illness, and then the electro Acuscope can help to get them going again.
I was over here about 2 years ago, and all of a sudden I just couldn't move my arm, and they swept me off to John's home, and we went over there and they hooked me up to the equipment. And again, I deal with physical therapists all day, orthopedists. I could go on all night, and I can only tell you that this equipment works. I run a hospital. I see acute care patients all day long, and this kind of equipment is incredible, and I think that we've got a real success story.
I am David Jones. I'm a physician. I have an active practice in Ashland, Oregon, and I also am very active in the field of functional medicine with the Institute of Functional Medicine. I've had the pleasure here at Sonovive, which is an internationally famous center of healing, having a sports injury treated by John Thorp. The injury was a fairly serious injury. At the time, I thought I had fractured my hip. And in injuries of this sort in the past that I've had, I've been dysfunctional for 6 to 8 months in the healing process. On this particular occasion, I was treated within the first 3 weeks and only lost a week after that of playing active tennis. It's been a marvelous experience seeing what treatment of this sort can do for sports injuries, ligamentous injuries, in this case, inflammation. It's been a pleasure getting to meet John and understand the kind of therapy that he's doing.
The thing that impresses me the most about this technology is the immediate results. I'm an osteopathic physician, so I'm very attuned to structural types of medicine. I've been very impressed by how fast this technology works and that you can see improvements right away.
Hello, my name is Dr. Luc Lemaire. I'm a chiropractor. I was trained in Canada at the University of Trois-Rivières Chiropractic College. I've been the head of the bioenergetic medicine at Sonovive in the last 2 years, and I have been blessed to see tremendous result with the use of the Electro Acuscope and Myopulse while we've been using the clinically proven protocols developed by the Thorp Institute. I've seen results in patients with chronic regional pain, fibromyalgia, promoting detoxification, just to name a few. The field of electrotoxicology is a brand new field of medicine, and it's in every walk of medicine, from the neurosurgeon to the physical therapist to the chiropractor office.
I see a phenomenal opportunity here for these machines in a variety of different settings, in individual doctors' offices, in chiropractic offices. I think it is an absolute magical tool that has a huge, bright future that I'm happy that John has asked me to be a part of helping to develop down the road. So if we can make a difference in terms of lowering that healthcare cost and improving healthcare quality or health quality, the future's wide open. It's almost a blue ocean space. It hasn't really been defined yet.
As a cardiologist for years, for decades, I realized that we're electrical. Our body's electrical. I've realized that one of the best ways of getting the body back into optimum health is using electrical energy. We're going to have to rewrite the physiology textbooks.
Using things like the Acuscope and the Myopulse, that's where doctors are going to really begin to see changes in people's health, and I think they'll like being doctors again.
All those movies that we saw, years ago, really are coming true today. So I'm really optimistic about medicine in the future. Vibrational medicine is the medicine of the future.
There is more than a major overhaul that's needed for all of conventional medicine. These frequencies open the gates, and they've actually shown it scientifically, this is science-based, that these low-level frequencies open the gates to allow toxicities out and to allow nutrients in.
Hi, I'm Dave Austin, a mental performance coach to many great pro athletes and college athletes. I've done a U.S. Olympic team, and I am probably the biggest skeptic when it comes to new kind of medicine or even old, whatever it is, because when people find out that I work with these elite athletes, I always get approached, oh, you got to try this, you got to try that. I don't do it because it's taken me years to build up the credibility. They trust me so much. Unless I thoroughly know it, I will never recommend it. My son, who plays quarterback at the University of Hawaii, had problems with his knee. So we decided to bring him over, work with John, and really helped him with his knees. And we thought, wow, there is something to this. So then I was working with the professional football team, and I got a stress fracture in my foot. And I went to the team doctor, and I said, what should I do? And he goes, oh, we'll just do a little surgery, put a little plate in there. And I went, I don't know if I want that surgery and plate. I said, John, can we do anything? So we did the Acuscope and the Myopulse, and my foot's fine. It's perfect. So after experiencing it with my family and then experience for myself, then I open up the door to all the professional athletes I work with, because I now know it all works. So when I recommend it, I know I'm recommending something that is going to help them. I've got pitchers in the Major League Baseball, 2 of them that probably, I don't know if they'd be pitching right now if I hadn't met John. They are just big believers now, and it's because it works. It's remarkable. It's absolutely remarkable, and I'm blessed that John was persistent and kept saying, Dave, believe me, trust me. I do now.
Hi, my name is Luke Scott with the Baltimore Orioles. I've been using the electric Myopulse and Acuscope machines, and to try and bring back some regeneration in my shoulder and speed up the healing process. Just in these last 8-9 days, I've experienced some really good results as far as increasing my range of motion. I experienced great results in my knees and in my shoulder, even before surgery. And I felt, within 5 treatments that my knees got about 5 years younger. I didn't have the stiffness, I didn't have the soreness, I didn't have the inflammation that I was experiencing at the time. I'm really confident that the use of this machine is going to help speed up my recovery.
Well, again, when you're healthy, you got a chance to really compete.
It's very important to use a Thorp certified Electro Acuscope, Electro Myopulse machine combination, and to also have a Thorp certified technician so that you can get maximum results.
Come in to pitch the 8th. 2-1 delivery, hit in the air, deep to right center field. Goodbye, home run, he's done it again. Luke Scott, a homer off.
I'm Linda Perry. I'm a licensed physical therapist. I have a master's degree in physical therapy from Northern Arizona University. I was diagnosed with rheumatoid arthritis in 1998. I purchased the equipment for my own use, and the difference in the results were significant. I was able to reduce the medication I was on significantly. I definitely reduced the number and the intensity of the flare-ups that I was having. Today I'm virtually with no flare-ups. I recently had a 76-year-old female who fractured her femur just above her knee. And 2 weeks later, when she had her first x-ray, it was noted that she was healing just fine and that she would not have to have surgery. I have had success with just about any low back problem, sciatica issues. Had a case where sciatica was probably experienced pretty frequently, was able to get that eliminated within 4 to 6 weeks, and she's pretty much without any sciatica issues at all. I had a gentleman who every year went into the hospital with sinus infection, did a very effective treatment using the sinus points in the toes and the sinus points on the face, and he went through his first winter without ever having to go into the hospital with any kind of infections. I've been involved in rehab with rotator cuff injuries, being able to restore full range of motion, decrease pain, post-rehab probably 2 to 3 weeks sooner than normally without the modalities being used. We have the only accredited program that has a licensed healthcare provider teaching the program. We are approved with accreditation from the Nevada State of Physical Therapy.
My name is Ted Lilly, and I'm a pitcher with the Los Angeles Dodgers. I met John 14 years ago. I had surgery in November of 2009 and needed to get back on the field and didn't have the time to take the normal recovery rate of 6 months or whatever it would be. So I ended up giving John a call, and he came up to the house and treated me for 3 days. And I didn't really think that it would happen quite this quickly, but I was throwing a baseball within 3 weeks and throwing without pain after the treatment. So for me, every time I get on the equipment, I notice a difference, and it's hard to discount the fact that the Acuscope works. Last year, my wife wanted to get an Acuscope, and she's a veterinarian, and earlier this year I was having some trouble and concern that I wouldn't be able to pitch the entire season. She's been treating me at home, and we're in August now, and I'm still pitching, and it's hard for me not to believe that the Acuscope has a great deal to do with that. Certainly, getting someone that's Thorp certified, understands the equipment, and knows the protocols and how to use it properly is something that I've benefited from.
Dr. Perez, I'm one of the treating physicians here at Sanoviv. I'm also the medical supervisor. The biggest usage that we have here for the Acuscope machine will be pain. And pain still is very subjective. What you cannot fake is the sincere look of the patient when it's looking at you and telling you, I feel a lot better. The pain is more controlled. And the fact that you're not using medication and another medication to try to control that pain, it gives you a very big advantage. For people who have been under long-term pharmacological treatment, this brings a new approach.
Hi, my name is Michael McNamara. I'm a baseball player. On the morning of the 23rd, I had been throwing the baseball, and I'd probably thrown about 200 baseballs already that day. Just, all my roommates and my teammates heard the crack. It was a spiral fracture of the humerus just from throwing. We're not really sure what caused it, but the radial nerve was caught in between the brace. You can see my wrist just hangs. I can lift my wrist maybe a millimeter, and dangly hands I can grip, but extension of the thumb, extension of the fingers, raising of the wrist is all not there. This is about, like I said, we're about 32, 33 days of post-op out of surgery. It's been 6 months since my injury, and about 3 months since I've been using John's machine. But now I'm full range of motion. You can see up here. Got it all feeling back. As before, my arm about 3 months ago was still, with the radial nerve, was still down like this. I mean, I couldn't move it at all. John would tell me to move it, and then it literally wouldn't raise. It would just be like this, hanging. I couldn't feel a thing, and now I'm full range of motion, and feeling's almost 100% back. So yeah, it's been awesome. So it's a miracle.